Good morning, Boquete. Good morning, Chiriquí. Welcome to the program. You are listening to Talking with Your Doctor with Dr. Shannon Tour. Buenos días, Chiriquí. Buenos días, Boquete. Están escuchando al programa Hablando con tu médico con la doctora Shannon Tour. Today is pretty overcast and cloudy. It's been a beautiful week, except for the afternoons when it's been raining really, really hard. Everybody, take care out there because cases of COVID are going up. We've had a big, big increase in cases of COVID. Whether you're vaccinated or not, you need to take all your precautions. Wear a mask when you go out, when you're in public. Try and stay away from crowds. Wash your hands. Really, really important. These new strains aren't as deadly as the previous strains that we've seen if you're vaccinated. So if you're unvaccinated, take even better care of yourself. I'm here with Dr. Ritzela Quintero, and she is a family medicine doctor. You've been working in May Lewis and in Hospital Chiriquí?
No, only May Lewis, but
Solamente en May Lewis, okay.
also in Boquete.
Also en Boquete. Ella está trabajando actualmente en May Lewis y aquí en Boquete. ¿Qué días trabaja aquí en Boquete?
It's with purpose appointments.
Okay,
Yeah,
so
it will be every Saturday. So if you need any attention, you just call, make the appointment, and I will come on Saturdays.
Okay, so she sees patients on Saturdays in Boquete, but with an appointment first. Of course, everybody's probably wondering, todos están preguntando qué es la medicina familiar, qué significa eso, what is family medicine, what does that mean? First, I want to get into a little bit of your background. Yo quiero hablar un poco de su historia, cómo, dónde estudió, por qué escogió la especialidad de medicina familiar. I would like to find out first why she picked that specialty, and a little bit about her history. Dime, por qué la medicina familiar?
Okay, so first of all, good morning to everyone. I'm really pleased to be here today. So I will try my best to speak in English, but if not, you will help me with the translation.
I will definitely help you with the translation. I know you were nervous about coming and speaking English. The plan was to,
Try to translate, yeah.
try to translate.
Okay, so I'm from Panama, but my family is from here, from Boquete. So I'm pretty east here in Chiriquí. First, I did as a general physician. I worked, and I decided it was better for me to do preventive medicine than to be more curative medicine.
Right.
So I did maybe 2 or 3 months here in the polyclinic of the
Social Security.
Yeah. And I really like primary care.
Okay.
I think it's really important because you can do a lot of preventive medicine, okay? It's cheaper and it's easier to do a good treatment of your hypertension, diabetes, dyslipidemia, than to cure or try to treat after you have a heart attack.
Exactly. That's
stroke.
what preventive medicine is. It doesn't mean we're going to prevent you from getting hypertension. It doesn't mean we're going to prevent you from becoming a diabetic.
Yeah.
It means once you're diagnosed, to take the steps to prevent that it progresses.
Yeah, and it's really important because sometimes we think, no, those are terms that only physicians need to know, but it's important for people to know that there are many levels of prevention. For example, if you are really young, you can do primary care or primary prevention in which you have risk factors. Obesity, your parents have diabetes, your diet, everything else, doing exercise, and that will help you prevent to get or develop a disease. But if you already have a disease, you can do secondary prevention.
Right.
And you can prevent complications.
That's
but
the
if
key.
you already have the complications, you can also do tertiary prevention when you
Right.
can prevent another complication.
Right.
So it's never late. You can always prevent something to going worse.
Okay, so that's why you decided to go
Yeah.
into family medicine, because it deals mostly with primary attention to either prevent future illness or prevent complications from current illness.
Yeah, because everybody has to age. but you don't have to develop diabetes, hypertension, or have any complication in that during your whole life. So you can actually age healthy, and it's better to do it by knowing what to do since you are an adolescent, or maybe if you since you're a kid. And I really like treating the whole family. When you have really healthy parents, you have really healthy kids. It's really common. I did a rotation in Texas. You know, you go big or go home. And in Texas, you can see some families that the parents are obese, and you see the kids obese. And,
Yes.
and that's really important, because sometimes you cannot treat just the mother, just the father, just the kid, because they eat the same things, they do the same exercise, they do the same activities. So I really consider that it was better for me to treat the whole family, and all the aspects are important that required to be you healthy, because it's not just physically, you have to be mentally, spiritually, and socially healthy. That's what is important in my specialty, right?
Now, family medicine here in Panama, and really in general in the world, is a pretty new specialty. It has not gained a lot of popularity yet, especially here in Panama. And most people don't know what a family physician does. They think, okay, family physician must be a general medicine doctor. No, that's not true.
No.
Family medicine is a lot more in depth. We treat the same, children, babies, all the way up until geriatrics. Yes, that's true. But you do a lot more in depth than general medicine does. We tend to refer out different conditions that we cannot treat ourselves. We're basically, you come to us, you have a cold, you have a sore throat, you have an earache. We treat. If it doesn't get better, then we refer.
Yeah.
You, on the other hand, have a lot more integrated knowledge, a lot more integrated skills.
Yeah.
And you're able not only to diagnose, but also treat all the way through and not have to refer on to another specialist normally.
Yeah. So it's a misconception that it's a new specialty, because actually it had a lot of years, but it's not that common.
Right.
So here in Panama, it's not usual to have a primary care doctor. It's not usual to have a primary care doctor who is a family physician. And here in Chiriquí, for example, there's only 4 family physicians. So there's not that
Not
much
many.
knowledge about I know. But if you come from Europe, United States, and Canada. In Canada, it's pretty common to have a family physician. You will know that the importance of a family physician is to have a doctor that knows everything about you. So if you need another specialty or another subspecialty, then he can do the referral to the correct specialty that is needed. Okay. So also it's important that what you said, I can treat any patient. My younger patients have 1 year and 3 months. And my oldest patient was 104 years.
Wow.
So it's a pretty wide range, right?
My oldest was 107.
Yes. Oh, okay, you win.
Not a contest.
But it's pretty important, because we can do a lot of primary care even if you are just 1 year old. And that's really important, because
even if you're a few days old.
Yeah. My favorite patients are adolescents. No one likes adolescents. Not even pediatricians nor internists. They don't like adolescents. But I really like them, because you have passed the time that your parents take the decisions, and you are not already in that age that you already develop hypertension, diabetes, and so if you have really healthy adolescents, they will age into really healthy young adults and really healthy older adults. So I really like adolescents, because I can mold them to be really healthy, So a family physician will try to give you the attention continuously through time, not just one time. It will have some appointments to check on you really closely. Sometimes when I see a patient, I call them or I chat them. So how are you doing? Do the treatment work? Do you need any other thing? And really in a comprehensive way. Like I will ask you, okay, your hypertension is not controlled.
Right.
But are you sleeping well?
Uh-huh.
Are you having trouble with your partner? Are you having trouble at work? Sometimes you have patients that they have to wake up at 3 a.m.
Mm-hmm.
and you are wondering why hypertension is not controlled, but
Right.
you are really not resting correctly.
Right.
Sometimes you go to other doctors and then just adjust the medication, but there are other things that can impact in your disease. So a family physician will take care of all those things, and that's the importance of the specialty, right?
Yeah, I've noticed that, the more you keep track of your patients, the more you check in on them, the more compliant they are with their treatment and the better results they will get.
Yeah.
And there's a lot of even general medicine physicians that just write the prescription and say, okay, come back when you need me.
Yeah.
I prefer having hands-on control.
Yeah, that's really
Yeah.
important. And for example, I do a lot with my patients that I gave them usually like a notebook where they have the medication they took, how much they need to take, and at what time. And that's really important because
Right.
after I do that, they sometimes require less medication because they were not taking them correctly. And when they have the information, that's health promotion, that you give all the tools to the patients to them to be healthy, and they not require you to be just over there like a policeman checking everything, so they can do really healthy decisions. And that's also really important because that will help them have some autonomy and self-care, and they will feel a little more power over their own health. Okay.
Because there's a lot of patients that I get that don't know why they're taking a medication.
Yeah.
They don't know what the medication is for. They don't even know the name of the medication normally.
Yeah.
It's a little white round pill.
Yeah. Yeah, the white one. The
Yeah.
white one. It's the big one. The big one. And
Right.
you are
The,
like,
the one that comes in the red and white box.
uh, sometimes you even know which the pill is because you have that much time
Yes.
listening to the patients about the white one, the one in
Yes.
the green little box.
Right.
And you already know what they're
You
talking
start to
about.
learn. You start to
Yeah.
learn because you already know what their health issues are, and you say, okay, this must be. Is it this many milligrams?
Yeah. And it's really important what you mentioned, that sometimes patients don't know why they are taking the medication.
Right.
Because if you don't know why you need to take your medication, you won't know which is the importance of the medication.
Right.
And if you don't know why it is important, then it will be harder for the patient to be more adherent with their treatment and everything.
Right.
So that's really important also.
You really have to cooperate with your treatment. If you don't come to us, if you try to self-medicate yourself or you try to hold off because you think it's going to just go away,
Yeah.
that's always a bad idea. You should always come in. We can't prevent if you don't come in. You can't wait until you get sick. A lot of them say, well, I go to the doctor when I'm sick and they didn't prevent me from getting sick, and they're supposed to be talking about prevention. Well, we want to treat you, but if you don't come in a timely manner, then we have trouble preventing these issues from coming up. So it's really important you take responsibility for your own health and you come and see either a specialist or a general medicine doctor that can refer you to a more specialized doctor to take care of these issues before they happen.
And that's why a family physician, it's important to do a really close monitorization, because sometimes you get a new medication and you have some symptoms. For example, it's pretty usual when you begin with metformin that you will get a lot of
Stomach
cramps.
issues,
Yeah.
yes.
So what do patients do? They stop the medication. They don't go again to the doctor
They
because
say they're allergic to it.
and because they feel shame about not continuing the medication and everything. And you have to really develop a relation with your patient. So if they don't tolerate the medication, if they feel like they have any symptoms that weren't before, it's not in good control, you can go again to your doctor and tell them, so this medication is not working, can we change it? I really don't like this pill, there are too many pills, and we can discuss, because I can hear what the patients need. Yeah, that's important, to take care of what they need and what they can do and can't do.
Also, if cost is an issue, because for a lot of people, they're on a fixed income. They cannot afford some of the medications that we prescribe
Yeah.
because they're the best ones for, and they will either space out the medication, not take it every day,
Yeah.
which is not good,
No.
or they stop taking it. But if you have a question, if you have, don't be ashamed to say,
Yeah.
I can't pay for this medication. Is there an alternative? Or maybe they're buying a brand name and they could buy
Yeah.
a generic, which
Yeah.
will work just as well.
Yeah.
But if you don't ask and you just stop, then you're doing damage to yourself.
Yeah, and you are losing your control, and sometimes it's hard to go back where you were.
Mm-hmm.
When I was at the residency, they tell us you have to have a phrase that is your signature phrase. And I always tell the patients, the best medication you can have is the best you can afford.
Mm-hmm.
It's not good for me to you to have the last type of medication
Right.
that is just coming, that is the best one. If you can only afford it to have it 3 times a week,
Right.
for example. So
All
if you-
medications are going to work.
yeah, but you have to use it daily or
Mhm.
as prescribed.
Mm-hmm.
But if you can afford the one that is the best one, but you can afford a cheaper one, and you can afford it to have it daily, it's preferred for you to talk to your doctor. But the good thing is that you have to follow your treatment. Another important thing is that treatment or management of the disease is not just the medication.
Right.
That's another important thing, that sometimes you go to the doctor, you have your cholesterol levels up, and they just gave you rosuvastatin.
Uh-huh.
But they don't tell you that you can have 2 carimañolas for breakfast.
Right.
So you are taking like 2 carimañolas, 1 tortilla, and then you take your rosuvastatin at night.
No.
That won't work. So diet, exercise, having a good mental health, a good relationship
sleep
health,
too.
that
Uh-huh.
would also help with your
Yeah.
disease.
Well, and we don't always start with a statin for high cholesterol either. If
Yeah.
it's not too bad, we try exercise, diet, modifying your daily routine.
Yeah.
Because it's not always necessary to go straight to a medicine.
Yeah.
There are times when, yes, it is. The high blood pressure, when it's extremely high, even if you come in for the first time, if it's 200 over 100, you probably require daily medicine, and
Yeah.
we're not going to wait to take it for a week to see
Yeah.
if it's normally like that. We're going to give you medication and have you take your blood pressure at home
Yeah.
a couple hours after taking the medication to see how you're doing.
Yeah, and that's really important to do follow-ups, because sometimes we think, okay, I already went to the doctor.
Yeah.
He gave me the medication, but we don't know if that's working.
Right.
So it's really important to do some follow-ups after you begin any medication,
Right.
or after we do any change of medication, to see if that new treatment is working. But to do all those things, you have to have a good relationship with your doctor. So that's really important. Even you can be urologist, cardiologist, that will work with every specialties you are visiting, because
You can't just go once.
yeah, yeah. But you have to have a good relationship and to trust what your doctor is saying, right?
Okay, so you treat babies.
Yeah.
You treat children.
Yeah.
You treat pregnant women.
Yeah.
You treat adolescents. Yeah, we already talked about that. You treat elderly patients.
Yeah.
So basically, you're across the board. You can do pregnancy control.
Yeah.
You even can deliver babies.
Yeah.
We all can deliver a baby, but you're actually.
I hope I don't have to. I really don't like that part of medicine, but
It's
I
not my
can.
favorite either. Yeah, we
Yeah.
all do. We all had to go through it.
Yeah.
We all had to learn. And emergencies happen. Somebody comes in and
Yeah, we
the
have
baby
to.
doesn't wait.
So we have to do what we have to do, but that's not my favorite part. But I can also do that.
You do minor surgeries.
Yeah.
You do. What else do you do?
Okay, so basically, a family physician, most important to do is health promotion. So health promotion will be to encourage the patient to take more participative like participar más.
Okay, yeah,
Yeah,
to take more control of their own
yeah,
health, basically.
to have more self-care in your daily life, right? We also do health prevention, what we have already explained
Right.
about primary, secondary,
Right.
and tertiary prevention. We also do some evaluation of health issues. It could be acute issues like a cold, UTI, an infection, or chronic disease, for example, hypertension, diabetes, lipidemia. We also, important, we can see children, adolescents, young adults, older adults, pregnant women, people with disabilities, and also people in palliative care. That's really important.
Oh, palliative. I left that out. Palliative
Yeah.
care is really important.
And we have, when we think of palliative care, we think, oh, only people with cancer, but that's not the
No.
case. We also have people with really severe heart disease that they are in palliative care and
Lung
they need
disease,
a follow-up. Yeah.
kidney disease.
Yeah, and kidney disease is really important because it's going up the levels of people in dialysis, right?
Yes, and dialysis at this moment is really scarce. We don't have all the equipment,
Yeah.
the number of equipment that we need.
Yeah, so,
So-
that's really important. We
Yeah.
also do follow-up of those people. We do preoperative evaluations. So if you have,
Preoperative, yeah.
So if you are gonna need someone to do an evaluation before having any surgery, I can help with that too. And minor surgery will require, for example, to do a drainage of an abscess, to do excision of lipomas, epidermal cysts. Those stuff that are really, you can do on the consult.
Right.
I can help with that. Okay.
Do you do biopsy?
I do, but you know that requires to be in sync with pathologists. And sometimes I prefer to do a referral to some of my friends in dermatology or something
Or
like that.
general surgery.
Yeah. So they can perform it in a better way with better equipment because sometimes I don't have the equipment.
Right.
So it's the best for the patient. I'll do a referral.
Because there are complications that can come with any type of excision of any tissue, bleeding.
Yeah.
And if you don't have a cauterization machine, then you're in trouble.
Yeah. So we have to think always if you cannot treat the complication, then you don't do the procedure.
Exactly. You have
So
to.
if I
take-
don't have the equipment, I prefer to do the referral.
Right. I have patients that come to me and they say, no, but I'm really uncomfortable. I want you to do it now. And I say, well, it's just not safe.
Yeah.
I have to send you to someone because if I do it here and there's a problem, then we're in trouble.
Okay. So I'm not the only one.
You're not the only one. And sometimes patients don't like that answer. They don't like it because
Yeah.
then they have to wait for an appointment. Dermatology is really scarce in Chiriquí. There's a few dermatologists, and they're always really, really booked.
Yeah. Also, cardiology. I have.
Oh, yes.
Yeah. It's really hard for a patient to get an appointment with a cardiologist.
It is.
So I hope in the next years that more specialists can come here to Chiriquí.
I hope so. And to Boquete.
Yeah.
Boquete is really lacking, and the closest place to go is David for a specialist, and that is really difficult for some people if it's an emergency, especially.
It's hard to get an attention if you live in Boquete and not go to David because most clinics, they work 24 hours, but it's a really like
Limited.
Yeah. If you have a stroke or if you have a heart attack, it's better to go to David because they have the equipment.
We stabilize in our clinic.
Yeah.
We stabilize. We have the resuscitation equipment. We have clopidogrel.
Yeah.
We have everything that we can give to before sending the patient down. But getting an ambulance here is nearly impossible.
You know that when I was a medicine student, they were beginning the construction of the new polyclinic.
Here in Boquete.
Yeah.
Okay.
And I was like, when I'm a physician, I will work in that polyclinic. Okay. So
And we're still waiting.
I became an intern, then a resident, then I'm a specialist, and still I'm waiting on the polyclinic.
Me too.
So I would really, really like to work in Boquete. My family is from here. They have always lived here. They produce coffee in Palmira.
Oh, wow.
Yeah.
Nice.
So I really, really like Boquete. It's my dream to live here with my husband and my kids. So.
It's expensive.
Yeah,
It's very expensive.
I know. It's a little cheaper for me because my family is here. We produce a lot of stuff, and we already have a home here. But
Right.
I know that from people that they want to move here to Boquete, it's kind of expensive. So.
Renting a place is expensive.
Yeah, I
Buying land is expensive.
Buying food sometimes can be
Buying
expensive.
food can be expensive.
But if you produce, I have perceived that many people that are foreigners, I don't know how to pronounce
Foreigners.
them. Yeah. They produce a lot. I have seen
Yeah,
them. Yeah,
yeah.
they have their little gardens in their house and they produce. That's really important. Like to take into consideration, and that will help also to your mental health, because to take care of your garden, that will help a lot. I have many patients that they do that.
Hobbies, yeah, you need hobbies, and even people that live in El Bajo, they have gardens on the roof. I've seen some gardens on the rooftop.
Yeah, that's nice.
Yeah.
You get creative when you need to.
But here you can get the freshest vegetables and fruits. Just go to any of the little markets. It's not expensive, really. They sell
Yeah.
unless you go to a supermarket. It's expensive in the supermarket.
Yeah.
But if you go directly to the people that are growing the fruits and vegetables, it's very cheap and it's
if
very
you are
easy.
vegetarian, you can totally live in Boquete.
Oh
right?
yes, oh yes.
And
You can grow anything here.
Yeah, no, but my husband always tells me that if you live in Boquete, you get like 5 years bonus of life, because here there's like no stress, like you perceive the weather is nice. I don't know, it's like I don't know, you feel really, really
It's calm.
nice.
It's tranquil.
Yeah.
It's calm.
Yeah, and that helps a lot, because I used to live in Panama, and
Oh, yes.
I'm not planning to move back, because I really like living in Chiriquí. I live
Yeah,
in
me
Chiriquí,
too.
and it's a little more move, but still.
Yeah, but it's still not like Panama.
No,
You
it's
don't
not
get
like
stuck
Panama.
in traffic for 2 hours.
So you will have family physician for long here in Chiriquí.
Oh, good. I'm glad.
That's nice.
And you'll have me for a while here in Chiriquí too, because I'm not going back to Panama City.
No, neither.
I was there for 20-something years.
Yeah.
And the city is just too hot, too
Yeah.
crowded, too stressful.
I remember that when we want to go to movies, we have to buy the tickets before and try to drive like 1 hour before, just to get on time to the movies.
Yeah.
And here we are like, we want to go to the movies. We just like take a bath and go really quickly to the movies and buy the tickets, and it is easy. But everything.
And with Federal Mall now, it's a lot easier too.
Yeah, a lot nicer.
We waited for a long time for that.
I know. That's really promising. More
Yes.
like to have a lot of, and they do a lot of activities. That's
Yeah,
also
for
nice.
children.
Yeah,
for,
my
yeah.
kid has to go over there.
Yeah.
And it's really nice.
Yeah.
In Halloween, he dressed up as Hulk, and we were candy treating.
Oh.
It was nice.
We do that. We do the trick or treating in our neighborhood. We have the local kids in the neighborhood come by, and I just hand out the candy. But really, Halloween is not something celebrated in Panama.
No, not that much. But still, Boquete is like a special place
Yeah.
here in Panama. And because we have so many foreigners, we have like a lot of festivities that are come from another places.
Yes.
And we also celebrate them. And that's really nice, because actually you are a citizen of the world, and you can like embrace all these cultural things that are coming here. I really like that about Boquete.
Now, I don't know if you've noticed, but I've noticed that when patients come from another country, especially the United States, they tend to have medical records from about 2 or 3 different doctors, their primary care, and then a few different specialists. Each doctor has their own medications, and it seems like they don't look at the other doctor's medications that have been prescribed. So a lot of them are repeated or doubled up.
Yeah.
And
That's important. I always, because patients, they don't understand what a family physician does. And the best way to explain it is like, I'm a director de orquesta. Like, I don't know how to translate that one.
Yeah, what is that called again? The orchestra's.
I feel foggy right now.
Yeah,
with that word.
the one that directs. The
Yeah.
director of the orchestra.
Yeah.
That works.
Yeah. So for people to understand, I will try to like look what the cardiologist says, what the pneumologist says, pulmonologist
yeah.
says. Yeah. So, and I will take all those recommendations and try to make them cohesive.
Yes.
That's the best word to assign to that, because sometimes you have the same medication but in different types, split in all these types of medications that
Right.
they usually are like there's some duplicity in them.
Yes, there's some that are just not necessary as well.
Yeah.
They're taking them and they no longer need the medication, or it's just excessive amounts of medications that they're
And
taking.
what happens here in Panama, for example, if you come from Canada, United States, you have a primary care doctor. But here in Panama, people don't have primary care doctors.
Right.
If they have like lower back pain, they want to go to a neurologist or nephrologist because they say it's their kidneys.
Right.
And people, kidneys don't hurt.
Right.
That's really
I
important.
try to explain that. Yes, I try to explain that. It's probably some other back pain or...
Yeah. And if you have like cough, you want to go to pulmonology. And if you have, but sometimes you can have a cough and it could be necessary to go to a cardiologist, to ENT,
Right.
to pulmonology, like to gastroenterologist because you have reflux. So
right.
that's what I do. I do a good history of
That's
the patient.
very important.
I do a good exam. I take into account all the previous history,
Right.
family history. If you smoke, if you drink, if you have take any drugs, anything like that. And then I decide which is the most possible diagnosis that we need to address.
Right.
Or which is the most urgent that we have to address. And that's important because then you will go to the specialist that you really need.
Right.
Okay? After that happens, that doesn't mean that you won't come back.
Right.
After you see your cardiologist, pulmonologist, and everything, you come back, and then we analyze what the recommendation is and integrate that to your previous medication.
Right.
So there won't be any duplicity.
And we
they
know
will-
what you're taking. Because
Yeah.
sometimes you come back to us and you say, okay, so we go through your medications again. You're taking this and this and this. No, I'm not taking this anymore. Oh, well, what are you taking now?
Yeah.
Because they don't report back to you that, and here in Panama, for some reason, when you send a referral to a specialist, you don't get a reply back.
Yeah.
So our patients come back to us as general med. What did your doctor say? What did the specialist say? I didn't really understand.
Yeah, or they gave me this prescription.
Yeah.
And you know what's that for? No, they just gave me the prescription, and that's what's really important to explain to the patient. And sometimes, you know what what also happens, that they receive new medication, and they think they have to stop all their previous medication, and that's not the case. So it's really important, like, to explain to them again what will continue, what will be stopped, and everything else, right?
Right, exactly. Because, we can't treat you well, or we can't. I mean, if you come to me and you're not giving me all the medications you're taking, and I see that your blood pressure's up, I don't know that you're taking a blood pressure medication already.
Yeah.
I give you another medication that works in the exact same way as the one you're already taking, and we're in trouble.
Yeah, and sometimes what also happens is, no, my husband, he takes perindopril. So I was with the blood pressure a little up, so I began perindopril. And no, but why are you here today? No, because I'm coughing. And because that is not maybe the best medication that you need. Because we think that we can take the same after your neighbor or your husband or your kids, but no. after we do the history, the exam, and everything, then we assign the medication that works the best for you, and that's different from
Right.
another patients. And that's really important to only take the medication that your doctor have prescribed to you, because if not, maybe you are taking the something that is not the best for you. Okay.
Because maybe you have a really low pulse rate and your spouse is taking a beta blocker or
Yeah.
something, and you take the beta blocker, your pulse rate is going to go down too. But you don't understand that that's what happens with beta blockers. You think
Yeah.
it's only for blood pressure.
And you are not supposed to know that because you are not a doctor. But
Right. That's why you're not supposed to take
okay.
other people's medications.
Yeah. That's really, really, really important. So,
And
it's-
don't take an extra dose just because your blood pressure went up higher. Come see the doctor
Yeah.
to find out why your blood pressure went up.
yeah. Also, what we do is that we explain what we are going to expect about a medication or a disease. For example, if you are taking a new blood pressure medication, and in 2 days you see your blood pressure is a little high, we as a physician, we need to explain to them that sometimes blood pressure medication take like 1 or 2 weeks
Right.
to stabilize blood pressure.
Right.
If your patient goes to home and they say, no, I'm calm because I know that my blood pressure medication will work in 1 or 2 weeks, they are without stress at
Right.
home. But if they don't know, they will get all anxious and they will go again, and they
And the
will
blood
go
pressure will go up.
Yeah. and you will go and see another doctor, and he will change the medication, but we didn't give the medication the time to work.
Right.
So
And you come back to the original doctor
Yeah.
and you see that the medication's been changed, but the blood pressure is still up. And then you say, well, you switched again, and it takes time to work up to the potency that.
yeah. So to sum up, it will be really continuous evaluations of a family physician, closely evaluations, appointments to do some follow-ups, and also comprehensive. And the key to everything is communication, because with your family physician, you need to feel like you can communicate or explain, or even you can get mad. That happens.
That happens.
Yeah, but you will feel free to express anything that you feel, and that's important. And I will take into account all the things that can impact in your health. As I explain to my patients, we are like a desk with 4 legs. The first leg is our physique, everything that is your body. You can have your whole body healthy. We have another leg, which is your psyche, and we can be mentally healthy. We don't have any decompensations, anxiousness, depression. We have third leg, which is spirituality. You don't need to be religious, but spiritually you have to have self-care, to be aware about others, those stuff. And the fourth leg, we can as doctors help as much, but it's important, is social. We need to have a good relationship with our parents, with our kids. It's not the same if you are physically healthy, mentally healthy, spiritually healthy, but you have your kids are abusing drugs, or you are healthy in all those aspects, but you are poor. You can't afford medication. So
That's our biggest challenge.
yeah, that's really important.
Yeah.
So sometimes we think that if we do diet, we do exercise, we are doing well. But all those legs that are not that stable will make your desk to tumble. So you have to take care of all those aspects in your health to be really stable. So that's important for my patients, and that's why I always tell them, try to get a hobby. Try to do diet, to do exercise. Try to have a nice relationship with your family, with your kids, with your friends. Try not
With your spouse.
yeah, that's necessary.
Yes.
It's not easy, but necessary. Remember, happy wife, happy life.
There you go.
So
You picked up too many of those phrases in Texas.
yeah, Texas, San Antonio, I
San
like that.
Antonio.
So If I want everybody to get from this interview is to try to get as stable as possible those 4 legs in your life, so you can have a really stable health. If you feel like you are not well enough, but you are taking care of your physique, your mentally, your spiritual, see if socially you are not that good, or if you are socially good mentally, spiritually, but you are eating McDonald's every other day, then you have
Oh, is
to.
that bad? No.
Yeah, yeah, I know.
The
It's
French
hard.
fries, though.
Oh,
The papitas.
I really like that.
Yeah.
Sometimes you can. Okay, not deviating from the theme, but,
No, no.
but that's really the message I want everybody to know. That taking medication is not just what is important about treatment.
We
You
don't like giving a lot of medication. We prefer not to have to medicate
Yeah.
patients.
And because it's easier sometimes, because it's easier, you can just give the statin to the patient, but it's a little harder to explain to the patient how they work, what they need to eat,
Right.
why they need to take the medication. Sometimes they have a normal cholesterol and they say, yeah, but I have already a normal cholesterol, can I stop taking the statin? Okay, I usually explain to the patients, before you were taking the statin, your cholesterol level was high. Now you are taking the medication, your cholesterol is okay. What do you think will happen if you stop taking your cholesterol medication? They will go up. So
Well, especially if you don't change diet.
yeah, so
And nobody changes diet. And
so
nobody changes exercise routine.
that's why it's easier to give medication, because it's harder to create new healthy habits. But we have to do our best and try to keep better self-care, because you only see your doctor maybe once a month, once every 3 months. And what is really important is for you as a patient to take control over your health, okay?
And notice changes. I have patients that come to me, like you were referring to with the cholesterol medication. Some patients have gotten off of it successfully and some have not. But those are the patients that have made a conscious effort to change their diet and change their exercise routine. Some people cannot because it's a family-related disease. But there are conditions which you will probably never get off medication. One is high blood pressure, and the other is high blood sugar.
Yeah, and sometimes that's why I really like to explain everything to the patients, even if they, for example, I'm a doctor, I'm used to knowing all those medical terms, but sometimes my patients, they can't explain perfectly to you what's happening with them. Because, as I mentioned before, you can do primary, secondary, and tertiary prevention. And sometimes you say, but my cholesterol level is okay, but you already had a stroke.
Yes.
So you are taking a statin to do secondary prevention and not to get another stroke.
Right.
But if you don't know that, you go home and you say, why I'm taking rosuvastatin if my cholesterol level is okay. I won't take the medication. That's not necessary. But it's because the doctor didn't explain what's happening. And that's why communication, again, that's the key. To explain to the patient why they need everything, so they will
You
be
have
aware.
a heart attack, you have a stroke, is for a reason.
Yeah.
Your cholesterol doesn't necessarily have to be really high, but they were high enough to be able to create the problem, or the lifestyle was there to create the issue
Yeah.
that caused the stroke or the heart attack.
And that's a key also, to have really healthy adolescents, because if it's easier if you have a patient 20 years old and you tell, okay, you can drink 10 beers a day. That's not healthy. But if you tell that to a patient that have been doing that for 50 years, it's not easier to get rid of that habit.
Right.
But if you begin like changing to healthy habits since you are 20, 18, 15, then you will develop into a younger adult that is not a healthy habit. It's a normal habit that you have to eat well, to not take that much alcohol, to avoid smoking.
Right.
It's better.
You can say it all you want, but I have some adolescents, they refuse to drink any water. It's all soda, juice,
Yeah.
sports drinks.
So give water to your kids.
Right.
Kids, since they are really small, so they will get used to.
What I do with the adolescents that only drink sugary drinks is I require them to have water after every sugary drink they have so that I can get them used to having water. If you have a Coke, you're going to drink another glass of water along with it.
And you need to get up to the new tendencies. I also, for example, I have some patients that they are really young and they are having trouble with migraine. And I tell them, like, okay, you have a smartphone, right? Go and look for migraine follow-up, and we download an app. And I tell them, okay, here in the app, you can tap every time that you have a migraine, how much it lasts and everything. I do that with also with diabetic patients. They can do all the graph or of the glycemic index, and they send them to me. And sometimes we can help with a lot with new technologies and everything because adolescents, they know how to use it, and also younger adults and even older adults.
A lot now.
Yeah. So
because I get graphs all the time from my diabetic patients, and I say, okay, there was a spike here. Why? And they can usually pinpoint, okay, well, that night I did this.
So we create forms to make people like change their habits and everything.
So they're aware.
And that about drinking water after a sugar drink, that's really important because they every time they will drink a sugary drink, they will remember they need to
drink a glass of water.
Yeah.
And then people don't like drinking a whole lot of water because it doesn't have any flavor, it doesn't have any sugar, it doesn't taste good to some people. And if you force them to remember they have to drink a glass of water, you know, I tell my patients 1 to 2 liters a day is your minimum that you want to drink of water. And it can prevent so many things. So many things. Headaches, body pains, dehydration.
You know what have been happening the last maybe 2 months because the sun was so heated. Many patients were like, I'm having too much migraines and everything, and we are having new UTIs and everything. And you know what was that? Because they get dehydrated.
Yeah.
So a good control will be when you go to the bathroom and you see your pee and it's really yellow, it means maybe you need a little more water. And you tell me, no, but I already drank 2 liters of water. Maybe you are sweating a lot, so you need more water. Okay?
Right. Because you lose water from your body from just breathing. You're losing water. Going to the bathroom, you're losing water. Exercise, you're losing water. And you lose water from so many different parts of your body during the day that you need to put back into your body because your body is mostly water.
Yeah. And you know, in Spanish we say loro viejo no da la pata. That is really hard for an older patient to do some changes. But the challenge this week will be try to drink your coffee without any cremora, any panela, any milk, any sugar. Not even brown sugar because it's the same as white sugar. You know, before
it's not healthier?
No, not really. No, but you see, before residency, I drank my coffee with stevia, which is a natural endulcorant. But during residency, I began to if I use 2 little, I don't know how to say, sobres,
packets,
and 2 packets of stevia, I down it to 1. Then after that, I would try with, and now I drank my coffee black as my soul. Okay, so try this week to do that. Maybe you have to challenge yourself and try to do it. The best thing is to do it like slowly. I tell my patients, if you eat at every supper like 2 measurements of rice, try not today to eat just a half. You go really slow. 1.5 for maybe 2 weeks. Then the next week 1 measurement, and then just a half of a cup, because it's easier to do it really slowly. So maybe you can change that. Try to eat a lot of sugar in your coffee. Drink a lot more water when you eat sugar drinks. Maybe begin walking 5 minutes every noon.
Right. You can tell people do 15 minutes of walking every day, and they say, well, I walk at work all the time. I go up and down. It's not the same.
No.
It's not the same thing. Patients that try to go and drastically change their diet because their blood sugar is up, because their blood pressure is up, end up having a really bad result because it's not sustainable to cut out everything
No.
that's bad in your diet
No.
all at the same time.
No.
We're not worried if your blood pressure and your blood sugar stay up a little bit for, a few weeks longer,
Yeah.
because we're giving you medication to control it.
Yeah.
It's not that something that we're that worried about unless you're really, really high. But we can control it little by little. But if you starve yourself and then, after you're doing great for 2 weeks, but after those 2 weeks, your body says, I need the carbohydrates, I need the salt, I need the sugar,
I need the fries from
I need
McDonald's.
the fries from McDonald's.
No, that's really, really, really important. And for example, I have some patients that they are diabetic and they have better control eating every group of food.
Yeah.
Totally, like they can eat once a week McDonald's.
Uh-huh.
They can eat once a week cake because they were at the birthday party,
Yeah.
and they have better control than just eating chicken and
Yeah.
chayote.
Well, your
Something like
body will still take it from
Yeah.
your body fat.
Yeah.
It will still take the blood sugar because it's used to having it up. So it tries to make it go to the original level that you're used to having it.
Mm-hmm.
In the beginning, we always say, hey, if you're under 200 during the day, we're happy. Then when you get it down a little bit further and you're at 180, we're happy.
Yeah.
Ideally, we want it 120, 130 during the day if you're diabetic. But I'm happy if they're going from 400 a day down to under 200. I'm celebrating.
Yeah, and maybe that happens a lot in obesity. You feel like you haven't lost that much weight, but you wake every morning with more energy.
Yes.
You feel like your pants, they are not that
Not as
tight
tight,
anymore.
yeah.
And those small things are even more of a success
Yes.
than losing weight.
Yes.
So, I mean, in general, talking with the family physician, we can stay here maybe until tomorrow.
Yes.
Because we can speak about maybe every disease, every other disease that you have in a consult. But the major thing that we need to know is that your family physician will listen to you, will take into account everything that concerns your health, and will try to make the most of all the controls that you need. Will refer you to the correct physicians. And okay, so if you want to have all of that, you can do an appointment, and it doesn't have to be with a family physician. You only have to have like a primary care doctor, because I'm just one in Chiriquí, and
Yeah.
I can take
Yeah.
every patient. But
No.
if you have a general practitioner that does primary care and does it really well, you just stick with that doctor that you feel confident, and you will have a really good control of your
Yes, I
health.
tell my patients, please don't go running to separate doctors.
Yeah.
Let's keep it all right here. If you need a referral to another doctor because you think that our relationship isn't effective
Yeah.
or that I'm not treating you as I should be,
Yeah.
then we will find you a primary care. But if you're always going to this doctor and that
Yeah.
doctor, and then this doctor told me this and this doctor told me that,
Yeah.
then I have to sort through it and go, okay, wait, let's do this. Come see me every week
Yeah.
until we get this under control. Please don't go elsewhere. Come back to me if you're having an issue. Same with you.
Yeah, and try not to feel like you need to change the doctor if the doctor doesn't tell you what you want to
Yes.
hear.
Yes.
Sometimes we need to tell the patient what they are doing wrong, what they can do better in a good way, but sometimes you will get a little...
We have to get strict sometimes. You're not doing the right
We-
thing, then we
don't-
have
we
to
don't
tell
like to, but we are thinking what's the best for you, okay? So I will do my little small propaganda.
Sure.
And I really like to have more patients here in Boquete. So I'm working in Clínica Especializada de Boquete.
you. Right.
But
Also known as Dr. Chen's clinic,
Yeah.
Dr. Gomez clinic, Dr. Shannon's clinic.
yeah. I was trying not to say Dr. Chen's clinic, but yeah.
Yes.
But
That's how it's known.
yeah,
Dr. Chen or Dr.
everybody
Gomez or Dr. Shannon. That's what they call it.
No, that's okay. I'm really pleased about that. That means they have really good doctors in the clinic. Yo, but I'm also working with Fundación de la Biblioteca de Boquete, and on May the 17th, we will have an activity that we will have free blood pressure measurements. So if you have hypertension, or if you know you're healthy and everything, you can go over there, since we will begin at 10 a.m. And they will do blood pressure measurements, and
Right.
if you have it high, low, normal range, we will assess you, and I will do a really quick consult about hypertension.
Great,
And you need
great.
to have a follow and everything, and it's a good way like to check if you are doing well. Maybe you get a new information.
Okay.
And it's really free, so you can just pass by and see. And that's because May 17 is Hypertension Awareness Day, and it's really important to be aware about hypertension, because it's really common. Like, we sometimes say that it's really that we have a combo in a consult is when people come with hypertension, diabetes, and dyslipidemia. It's like having Coke, hamburger, and fries.
You won the trifecta,
yeah, they come together. So
Yes.
Because it's that common to see high blood pressure patients, we want to do that activity. So we will be there, and I hope that you can pass by.
And in case you forget any of that information, it is on my Facebook page, Doctora Shannon on Facebook, and it's also on my Instagram.
Yeah.
You also have an Instagram account.
Yeah, my Instagram account is doctora.Ritzela Quintero. I can send it to you so you can post
Sure,
it.
I can post
in
it
the
again.
Facebook.
And
I know that my name is super common, just as Maria, but
Ritzela, when I saw the name Ritzela.
no, it's not that common.
No,
But
I've never heard that name.
But once you read it, it's really easy to remember.
It's easy, yeah.
Yeah. So over there, I will try to post a little more, but there will be the information about the activity.
And I will forward on your post, so, send me whatever you need, and I'll put it
Yeah.
on my page too.
I really like that.
For an appointment at the clinic, you can either call 720-2080 and ask for either, if you forget her name, ask for the family medicine doctor. Okay, ask for an
There's
appointment.
just one.
There's just one at the clinic at the moment. Or, I guess, contact me and I can put you in
Yeah.
touch with her, or, any.
You can even send me a direct message in Instagram.
In Instagram,
And
yeah.
I can assess you where you want to be attended and everything. And
Uh-huh.
I can give you the phone number. But I'm really pleased about the invitation, and I hope I made myself clear.
I think so. I understood everything.
So I'm working on my English, so I will try to like polish everything so I can come again. But I
Great.
hope
We'd
that
love to have you on the show again.
the information was good, that you attend to your primary care doctor and really take care of your health.
Yes, we're not offended. Come to either of us, any of us. Please, just
Yeah.
take care of yourself.
Yeah.
One small note. They've approved for over 50 years old the second booster. A lot of people ask, is it necessary? If you have previous health concerns, probably is necessary. Always talk to your doctor first. Where are they giving it? They're giving it at the Public Health Clinic, MINSA, and the Social Security Clinic. Now, I understand here in Boquete, they're only offering it 2 times a week, and that you have to make an appointment. So you have to go to the adult health section of Social Security Clinic to program your appointment to get the second booster. Please don't just write and ask me if you should get your second booster. That's individualized. You should come see me or come see Dr. Ritzela to ask that question so that we can better advise you. We
Yeah.
can't really advise you online of whether you should get it or whether you should not get it.
Yeah. So every person is different. We will assess about how you did with the previous boosters, and then we can give you a better recommendation. We can see all your previous history and everything, but the best thing you can do is ask your doctor.
Right. Don't ask friends. Don't, ask us on WhatsApp or online, because that we just can't answer that question for everybody online.
Yeah.
Come see one of us and ask. So I would like to end the show by thanking Roger Guerra. He's the director of the station, the owner of the station here in Boquete.
Can you say my name again? My
No.
last name?
Guerra.
Roger Guerra.
I can't say
Roger
it.
Guerra.
I'm not speaking Spanish since I was a kid, so it's really hard for me to pronounce
Yeah.
the double R.
I know.
So,
So do the Ritzela again.
Ritzela.
But you did that well. I don't know.
I don't know. I don't know. It comes and goes.
Yeah.
Would you like to say anything, Roger?
Well, I'm really surprised. I was looking at the numbers for COVID in Panama City, and it's
Really spiked.
Spiking up.
Yes.
Right.
Too much. But that's because of the new variant. It's more contagious.
Yeah. And also, there's a theory that maybe it will be a little seasonal, like we see a flu or influenza, that it will
Right.
have some spikes every year.
We are in our winter time right now with
Yeah.
the rains. And that's when we usually see the spikes in flu. Get your flu shot.
Yeah, I hope that it's just a spike and it will be, as we have seen lately, that is just flu-like symptoms and
Not a whole lot of hospitalizations,
Yeah.
not a whole lot in ICU unless they're unvaccinated or have pre-existing conditions that
Yeah.
are serious. Yeah.
so that's why really important to get your boosters.
And that's why it's really important to come to us to see if you need a booster too.
Exactly.
I know this couple, and she has COVID, and he doesn't.
Yeah.
So I was wondering about who is more, I don't know, man or woman. Is it
I don't think there's a distinction between men and
No?
women. I think there's a distinction more in
Previous is
previous health issues.
okay.
Some people are more protected. They found asthmatics are more protected because they have a certain receptor
Yeah.
that kind of resists severe infection. Not saying that they can't get the infection,
Yeah.
but resist serious infection. But yes, it is possible for two people in the same family, one be infected and the other not.
And what also helps is that if you have any family member that has COVID, is positive for COVID, to do all the recommendations, to wash your hands, wash all the dishes and everything that the patient uses. Because I have seen that when families have a really good hygiene
Yes.
and they have really good system of working with the patient that is positive,
Uh-huh.
they tend just to be just one member that is positive and the other don't get the disease.
Right, right. As long as you're keeping your distance and
Yeah.
wearing your mask when you're around that person
Yeah.
and keeping them in one room.
So that's possible. You
It is
cannot
possible.
get-
Yeah. It is a little bit, mind-boggling because you're already with that person when they're contagious before they start showing symptoms.
Yeah.
But it happens. It's very possible. It happens with the flu. It happens with all kinds of illnesses. Not everybody in the family always catches it.
Yeah. So sometimes you see, but I slept with him yesterday. I won't use the mask because I was with him yesterday.
Right. I was
so-
already in the same
Yeah,
room. I was
but
already in the same bed. I was
Still,
already,
try to
yeah.
use your mask and do all the preventive care you
Right.
can do.
Because the more of the viral load that you get,
Yeah.
the more possibility that you show symptoms. Well, we've gone a little bit over. We were
Yeah.
permitted to go a little bit over on our time today, but I don't want to take any more of your valuable time.
Nah.
I know you have other things that you
Nah.
and your family.
Yeah, it's okay.
So I would like to thank you for coming on today. It was a very interesting program. I think that the listeners enjoyed it, and now they know more about the specialty.
I hope so.
And ask me about getting an appointment with her if you feel you need one.
Yeah.
I will definitely be referring patients that need more specialized care on to you now that
Yeah.
we've spoken a lot. Because there are many that I get to a certain point where I just can't go any further and I have to refer them on.
Yeah.
So I would also like to thank Suleika for her time. She's our engineer today. She's always done a great job for us. And I would like to thank Veronica down in David for permitting us to have the signal today. Everybody have a great weekend. We will see you next weekend on Saturday, same time, same place for Talking with Your Doctor. Have a great day, everybody.